I want to start this evening actually sharing a poem with you. And this poem is going to completely encapsulate the message and the purpose and the intention of what it is that we do. It's our life purpose. And if you listen closely and you really, really, really understand the poem in the depths of your soul, you will make a change in how you take care of you and your family when you leave here this evening. If you don't understand the poem, we'll have another event like this in 6 months, and you can come back and hear me say it again. How's that sound? Fair? We'll buy you dinner. Bring a guest. It's called The Dangerous Cliff, and it goes like this. It was a dangerous cliff, as they freely confessed, though to walk near its crest was so pleasant. But over its terrible edge there had slipped a duke and a full many peasants. The people said something would have to be done, but their projects did not all tally. Some said put a fence around the edge of the cliff, some an ambulance down in the valley. The lament of the crowd was profound and was loud as their hearts overflowed with their pity, but the cry for the ambulance carried the day as it spread through the neighboring city. A collection was made to accumulate aid, and the dwellers in highway and alley gave dollars and cents not to furnish a fence, but an ambulance down in the valley. Said one to his plea, as a marvel to me that you give so much greater attention to repairing results than to correcting the cause. You'd much better aim at prevention. For the mischief, of course, should be stopped at its source. Come neighbors and friends, let us rally. It is far better sense to rely on the fence than an ambulance down in the valley. He is wrong in the head, the majority said, would end all our earnest endeavor. He's a man who will shirk his responsible work, but we will support it forever. Aren't we picking up all just as fast as they fall and giving them care liberally? A superfluous fence is of no consequence if the ambulance works in the valley. Now the story looks queer as we've written it here, but things often occur that are stranger. More humane to serve than to cover the hurt is the plan of removing the danger. The best possible course is to safeguard the source and attend to things rationally. Yet build up the fence and let us dispense with the ambulance down in the valley. What we do in our practice is help you build fences so you never fall during your lifetime. Now, I know that that's a challenging thought for some of you here because you've been raised in a society that tells you that you're guaranteed to become more diseased and more disabled as you continue to age throughout your entire lifetime, because that's the ambulance at the bottom of the valley healthcare model. You are broken from the moment you come out of your mother, and you will continue to break the rest of your life. And at some point, actually in the United States, age 56, you'll be diagnosed with your chronic illness, of which you will die from 10 to 15 years later. That's the lowest age of all industrialized nations, age 56. We have a problem with our healthcare system. The ambulance in the bottom of the valley is failing us miserably, and unfortunately, many of you are considered collateral damage. 400,000 people every year die from medical mistakes. So more than 1,000 people die today from a medical mistake. It's the third leading cause of death in the United States behind cancer and heart disease and cancer in that order. And yet, we don't think anything about it. We just continue to move on, continue to pick. Are we picking up all just as fast as they fall and giving them care liberally? No, we're not. We're not. We're failing. It's the most expensive and least effective healthcare system in the entire world. And we're going to teach you tonight about some alternatives. Some very, very, very profound alternatives. Now, you see this quote on